The laser eye surgery is a kind of technology called excimer. Okay, what happens is that this excimer technology is used to essentially recontour the surface of your eye, and that changes the focusing of your eyes so that rather than relying on glasses or contact lenses, you can see well without them. I think everybody that comes to us for laser eye surgery or for vision correction generally, the first thing that's in their mind is this is actually quite a frightening thought to have someone do something to your eyes. We completely understand that, and part of what we do here is take you through a process where we demystify things. We give you information about what the treatment is, the safety profile of it, and give you a chance to get used to it so that you feel much more comfortable with it. At your first appointment, what you'll do is come with us for a tour of the laser suite itself. You'll have a chance to lie on the laser bed to talk through what you'll actually see and experience and feel and hear on the day of your laser treatment, so that when you come to the treatment itself, it's all familiar and you know what to expect and everything goes as planned. Now, in addition to effectively having a dry run at that, you want to have time to talk about your specific concerns, what are the chances of success, what are the potential complications, and understand that it's really a very safe technology indeed. Now, in order to give you time for all that information to sink in, we'd like you to go away with some information to read through at home, digest that in your own time, and think about any questions that you have so that when you come back to see us the next time, you can go through those again. So again, it's really all about preparation. And once you come to the point where you're going for treatment, you're as relaxed and as prepared as you can be. Not everybody is suitable for laser treatment, but most people are suitable for some form of vision correction. We prefer not to treat people below the age of 21 because when you're younger, we know that your spectacle prescription can be changing as you mature. So we're looking for some evidence that has stabilised and that you're at an age where when we treat you, it's likely to be a long-term solution. Similarly, as patients get older and maybe move to their 40s and 50s, they may be more suitable for non-laser forms of vision correction, such as lens replacement surgery. And some prescriptions also render you unsuitable for laser eye surgery and maybe more suitable for things like implantable contact lenses instead. In terms of explaining to you about what happens when you go through laser procedure itself, the first thing to be aware is that you will, on the day of treatment, be really nervous. And again, speaking from personal experience, I don't think there's much you can do about that. You just have to be aware that that will happen and that we understand that you're nervous and we'll kind of support you and make sure you're well looked after throughout the whole thing. When you go through to the laser suite, you'll have drops put in your eyes, which will make your eyes, anaesthetic drops, which will make sure that your eyes are comfortable throughout the procedure. And you'll be asked to remove your glasses as you go into the laser suite. So that, for many people, gives them a kind of surreal, dreamlike feel about the whole procedure because everything in the world becomes defocused at that stage. The laser machine itself consists of a bed to lie on, and then you're looking up at the laser. So you'll lie down. You'll have a support under your knees to support your lower back, and you'll be given someone's hand to hold. Now, the time you're actually in the laser suite is about 20 minutes in total, but with the modern laser technology that we have, which has sped up over the years, the part of the technological advancement has been making the laser faster, you can expect for the average person to be treated for about 4 seconds per eye for the actual procedure itself. Once you've got the anaesthetic drops in, your eyes will feel comfortable and you'll feel some cold water sort of sloshing around your eyes. And you'll be asked to look at a light which is a flashing green light. And that's really all you have to do. You don't have to worry about blinking. That's completely taken care of for you. You look at the green light and you may be given some instructions like move your head slightly. But essentially when it comes to the treatment itself, you're simply looking at a light and relaxing. And actually, it's a very unusual light display, so it's a unique opportunity to experience this event in your life. Laser eye surgery is incredibly safe. It's been around for over 20 years. Over 1 million people have been treated now with really good visual outcomes. There's a very common perception out there that eye surgeons do laser eye surgery but would never have laser eye surgery. And the reality is that eye surgeons are actually 4 times more likely than the general public to undergo laser eye surgery themselves. And that's because the results are so good. And we know that working in the profession. I underwent laser eye surgery several years ago now for the treatment of short-sightedness. And since then, I haven't worn glasses at all. And it's been a really satisfying and rewarding thing to have gone through.